Right now, as you are watching this, your feet might be trying to tell you something absolutely critical about your health, and the terrifying part is that most people completely ignore it. Here is a fact that should stop you in your tracks. According to the American Diabetes Association, nearly 1 in 5 people living with type 2 diabetes do not even know they have it. That means millions of people are walking around every single day with a condition that is silently damaging their nerves, their blood vessels, and their organs, and the earliest whispers of that damage are showing up right there in their feet. So before you scroll past or click away, I want you to ask yourself one question. When was the last time you actually looked at your feet and paid attention? Because what you are about to hear in the next 20 minutes could genuinely change your life or the life of someone you love. Welcome back. If you are new here, this channel is dedicated to giving you clear, science-backed health information that your doctor sometimes does not have the time to fully explain. Today we are talking about the 9 warning signs in your feet that could mean diabetes. And I'm not just going to list them off. I want you to truly understand why each one happens, what is going on inside your body, and most importantly, what you need to do about it. Because knowledge without action means nothing. So let us get into it, starting with the one sign that affects the most people and yet goes unrecognized the longest. The first sign is numbness, or a tingling sensation in the feet, and this is probably the most common early warning sign of diabetic neuropathy, which is nerve damage caused by prolonged high blood sugar. Here is what is happening inside your body. When blood sugar levels stay elevated for extended periods of time, the excess glucose begins to damage the small blood vessels that supply oxygen and nutrients to your nerves. The nerves in your feet are the longest nerves in your entire body, which makes them the most vulnerable. Over time, this damage disrupts the nerve signals traveling between your feet and your brain. What you feel on the surface is a tingling, a pins and needles sensation, or a gradual numbness that often starts in the toes and works its way up. A lot of people dismiss this as poor circulation from sitting too long, or they blame it on tight shoes. And yes, those things can cause temporary tingling too. But here is how you can tell the difference. Diabetic neuropathy tingling tends to be persistent, it happens at rest, it may be worse at night, and it does not go away when you shift your position. If that description sounds familiar, that is a red flag that demands a conversation with your doctor. Now let us talk about the second sign, which is closely connected to the first, burning pain in the feet, particularly at night. This one surprises a lot of people because they assume that if they had nerve damage, they would feel less pain, not more. But here is the reality: nerve damage is unpredictable. In some cases, damaged nerves stop sending signals, which leads to numbness. In other cases, damaged nerves become hypersensitive and start firing pain signals constantly, even when there is no physical cause. This is called neuropathic pain, and it is described by patients as a deep burning, a stabbing, or an electric shock-like feeling that tends to intensify at night when the body is at rest and there are fewer distractions. People suffering from this often cannot sleep, cannot bear even the weight of a bedsheet on their feet, and they frequently go years without connecting this pain to a blood sugar problem. If you or someone you know is experiencing this kind of foot pain at night, please do not just reach for a painkiller. Get your blood sugar tested. The third sign to watch for is foot ulcers or sores that refuse to heal. This is where diabetes starts to become genuinely dangerous, and this is one of the leading reasons people with uncontrolled diabetes end up in the hospital. Here is the underlying problem. Diabetes damages blood vessels, reducing circulation to the feet. Without adequate blood flow, the tissue in your feet does not get enough oxygen and nutrients. This means that even small cuts, blisters, or pressure sores, injuries that a healthy person's body would heal in days, can take weeks or months to heal in a diabetic patient, or may not heal at all. To make things worse, nerve damage means the person often cannot feel the injury in the first place, so a wound can grow significantly before it is even noticed. This combination of poor circulation and reduced sensation creates the perfect storm for serious infections. In the most severe cases, these infections can progress to gangrene, which is tissue death, and can ultimately lead to amputation. This is not meant to frighten you, it is meant to impress upon you the urgency of taking foot wounds seriously if you have risk factors for diabetes. Any sore on the foot that has not healed within 2 weeks needs medical attention immediately. The fourth sign is changes in skin color on the feet, particularly a darkening of the skin in the creases and folds, or patches of unusually pale or bluish skin. Let me explain both of these separately because they mean different things. Dark, velvety skin patches, a condition called acanthosis nigricans, are often a sign of insulin resistance, which is a precursor to type 2 diabetes. This discoloration most commonly appears at the back of the neck and in body folds, but it can absolutely show up on the feet and ankles. It happens because excess insulin in the bloodstream stimulates skin cells to reproduce too rapidly. On the other hand, pale or bluish skin on the feet signals something called peripheral arterial disease, or PAD, which involves the narrowing of blood vessels due to plaque buildup, a condition that is significantly more common in people with diabetes. Pale or blue-tinged skin means blood is not reaching the area adequately. If you press on the skin and it stays white or pale for longer than 2 seconds before the color returns, that is a circulation warning sign you must take seriously. Moving to the fifth sign, cold feet, even in warm environments. Now, everyone has cold feet sometimes, especially in winter. But if your feet are persistently cold, even when the rest of your body is warm, even when you are wearing socks, even in the middle of summer, that is a different story. Persistent cold feet in people with or at risk for diabetes is usually a sign of poor circulation caused by vascular damage. The blood vessels that should be delivering warm, oxygenated blood to the feet are compromised. Think of it like water flowing through a partially clogged pipe. Less water gets through, and what does arrive is slower and cooler. One important thing to note here is that this sign can overlap with the numbness we discussed earlier. Some people with diabetic neuropathy cannot even feel that their feet are cold because the nerves have been damaged. This is why family members or caregivers sometimes notice cold feet before the person themselves does. The sixth sign is dry, cracked skin on the feet, especially around the heels. Most people think of cracked heels as a cosmetic issue or simply a result of not moisturizing enough. And sometimes that is all it is, but persistently dry, cracked and thickened skin on the feet, especially when combined with other symptoms on this list, can indicate that the autonomic nerves controlling sweat glands in the feet have been damaged by high blood sugar. These nerves regulate moisture production in the skin. When they are damaged, the skin stops producing adequate oil and sweat, leading to extreme dryness that no amount of lotion can fully correct unless the underlying blood sugar issue is addressed. Additionally, deep cracks in the heels can become entry points for bacteria and fungi, leading to infections that are especially dangerous for diabetic individuals due to the healing problems we discussed earlier. The seventh sign is a hammer toe or other changes in foot shape. This one catches a lot of people off guard because it seems structural rather than medical. But here is what is happening. The nerves that control the small muscles in your feet are damaged by high blood sugar. These muscles help keep your toes straight and balanced. When the nerves malfunction, certain muscles become weaker while opposing muscles stay strong, causing the toes to curl or bend into abnormal positions, which is what we call hammer toe or claw toe. Changes in foot shape can also lead to unusual pressure points, calluses and sores developing in places that were not designed to bear that kind of load. This is another way that diabetes contributes to foot ulcers, not just through reduced circulation but through physical deformity that creates new injury-prone areas. If you have noticed your toes starting to curl or your foot arch changing in recent years, get your blood sugar levels checked. The eighth sign is fungal infections that keep coming back. Nail fungus, athlete's foot, and other fungal conditions are more common in everyone, but they are significantly harder to treat and far more persistent in people with uncontrolled diabetes. The reason comes down to two factors. First, high blood sugar essentially feeds fungi, creating an environment in which they thrive. Second, the immune response in diabetic patients is often impaired, meaning the body cannot fight off infections, including fungal infections, as effectively as it normally would. Signs of nail fungus include nails that are thick, brittle, yellowed, or that separate from the nail bed. Athlete's foot causes itching, scaling, and redness between the toes and on the soles. If you have been treating a foot or nail fungal infection for months with over-the-counter products and it keeps returning or never fully clears, that is a strong reason to speak with your doctor about screening for diabetes. The ninth and final sign is hair loss on the feet and lower legs. This one is rarely talked about, but it is genuinely significant. If you look at your lower legs and notice that the hair is thinning or has disappeared, particularly below the knee and on the tops of the feet, this may indicate peripheral arterial disease, the same poor circulation problem we discussed earlier. Hair follicles need a consistent blood supply to function. When circulation is impaired, those follicles slowly stop producing hair. It is a subtle sign, and it is easy to explain away, but in the context of diabetes, it is a meaningful data point. Men often notice this first because leg hair loss is more visible against their baseline. Women who shave their legs may not notice until they observe that regrowth has slowed dramatically or stopped. Now that we have covered all 9 signs, it is worth stepping back and talking about what you should actually do with this information. The most important thing is not to panic, but also not to ignore. If you recognize 1 or 2 of these signs in yourself, that does not necessarily mean you have diabetes. Some of these symptoms have other causes. But if you recognize multiple signs, particularly if you already know you have risk factors like a family history of diabetes, being overweight, having high blood pressure, or being over the age of 45, then this is your body telling you it is time to act. See your doctor and ask for a fasting blood glucose test or an HbA1c test. These are simple blood tests that can tell you a great deal about your blood sugar levels over time. Early detection is genuinely life-changing. Caught early, type 2 diabetes can often be managed and in some cases reversed through lifestyle changes including diet modification, increased physical activity, weight loss, and in some cases medication. The people who suffer the most severe complications, including amputations, kidney failure, and blindness, are often those who were not diagnosed until the disease had already progressed significantly. You can also start making simple protective habits a part of your daily routine right now. Inspect your feet every single day, look between your toes, check the soles, and note any new cuts, blisters, or color changes. Wash and dry your feet thoroughly, paying attention to the spaces between the toes where moisture and fungi love to hide. Moisturize the tops and bottoms of your feet, but avoid putting lotion between the toes. Wear well-fitting shoes and never walk barefoot, especially on hard floors or outdoors. Change your socks daily. These steps cost nothing and could prevent a world of complications down the road. And for those of you watching who have already been diagnosed with diabetes, please take your foot care even more seriously. Work with a podiatrist, a foot specialist, who can become a critical part of your diabetes care team. Even if your feet feel fine, schedule regular checkups because remember, the damage can happen silently and the nerves that would normally alert you to a problem may already be compromised. To bring everything together, your feet are one of the first places your body will show signs of trouble when blood sugar has been elevated for an extended period. The 9 warning signs we covered today: numbness and tingling, burning pain at night, non-healing sores, skin color changes, persistent cold feet, dry cracking skin, changes in foot shape, recurring fungal infections, and hair loss on the lower legs are not to be taken lightly. They are your body sending you messages that deserve to be heard. The earlier you act on these signals, the better your outcome will be. Please share this video with someone in your life who might need to hear it, because this information could genuinely make a difference. If you found this valuable, make sure to subscribe to the channel, give this video a like so it reaches more people who need it, and drop a comment below telling me what health topic you want me to cover next. I read every single one, and it helps me make content that truly matters to you.